adolescence. In the early years of adulthood are a time of life when many changes occur. For example, changing schools, leaving home, and starting university or a new job. For many, these are exciting times. They can also be times of stress and apprehension. However, in some cases, if not recognized and managed, these feelings can lead to mental illness. A mental illness is also called mental disorder or psychiatric disorder. It's a behavioral or mental pattern that causes significant distress or impairment of personal functioning. Mental disorders are usually defined by a combination of how a person behaves, feels, perceives, or thinks. There's one example of mental illness: depression. Depression or major depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and or a loss of interest in activities once enjoyed. It can lead to a variety of emotional and physical problems and can decrease person's ability to function at work and at home. Depression is a common mental disorder globally. More than 300 million people of ages suffer from depression. According to the Centers for Disease Control and Prevention or CDC, 7.6% of people over the age of 12 have depression in any 2-week period. This is substantial and shows the scale of the issue. Depression caused by physical abuse, sexual abuse, or emotional abuse can increase the vulnerability to clinical depression later in life. Certain medication. Some drugs, such as isotretinoin, used to treat acne. That antiviral drug interferon alpha and corticosteroids can increase your risk of depression. Conflict. Depression in someone who has the biological vulnerability to develop depression may result from personal conflicts or disputes with family members or friends. Death or a loss. Sadness or grief from the death or loss of a loved one, though natural, may increase the risk of depression. Genetics. A family history of depression may increase the risk. It's thought that depression is a complex trait, meaning that there are probably many different genes that each exert small effects rather than a single gene that contributes to disease risk. Major events. Even good events such as starting a new job, graduating or getting married can lead to depression. So can moving, losing a new job or income, getting divorced, or retiring. However, the syndrome of clinical depression is never just a normal response to stressful life events. Other personal problems such as social isolation due to other mental illnesses or being cast out. The question is, how you can prevent or fight the mental illnesses. Preventing mental health problems means starting in the earliest years of life to promote healthy social and emotional development. Identify and address concerns as soon as possible and support those who surround young children. There are ways to identify mental health problems in young children and effectively treat them. Parents, pediatricians, guidance counselors, home visitors, friends, family, and child care providers can be the first responders to mental health concerns, catching problems early and intervening before they become more serious will provide the best chance of helping all young children succeed and live healthy, happy lives.
Last night, lead me to the cross.